have done about 22 live donor transplants in kidney. Now, these people who are waiting, they don't have a donor, live donor for them. And they're all waiting for such an incidents where they would get a kidney from cadaveric donors.
Doctor, is there any program or any this thing for doing confidence building in kidney means organ donation? Most of the time, what happens is people have that fear of donating this thing, and also how do you means how your doctors are doing?
We have our own programs every year. We observe World Kidney Day, we observe World Liver Day, we observe one World Heart Day, and every time we give you videos. Like last time, one boy of same age, I think he was 21. He was working in Kalangut. He was from Jharkhand. No, he donated all organs, lungs and liver, kidney, and with his heart. I know we have a video that person who received heart. He was told if you don't get heart within 48 hours, you would die. And he is the rich man of Mumbai. Actually, he could afford, but who will give heart like that? So, to his good luck, this heart was matching his body, HLA, and then we sent the heart to HN hospital, and he has sent a video. We can share that video with any one of you. That video is with our Soto office, and where he says he is now living normal life. It's really a great program, cadaveric donation.
GMC is charging for these organs and all बाहेर काढला ते कधी
No, nothing.
free of cost.
This involves no financial anything, but on as a good gesture, Office of Dean has provided an ambulance to this boy's dead body to be taken to Varanasi. He is from Varanasi, where we have paid. I don't want to say all that, but we have paid from our office. Plus, we have taken the father and brother on by flight because they wanted to have last rites in Varanasi. Actually, for a dignified funeral, there is a provision of 10,000 rupees for a donor. But that 10,000, if patient is outstation, it is less. So we had to pay from our official this. I have also requested Honorable Health Minister Sri Vishwajit Ane to felicitate the father because when he was in such a grief, he took that bold decision of donating organs of his son who was brain dead in ICU, who was only 19 years old. So that kind of decision cannot come from an ordinary person. So I would call him a hero of this whole program. And I wanted Honorable Minister to come and felicitate him. So once he's in town, we will do this job. We will also inform you. And this is only to see that we encourage such people. If it is done in a ex hospital, the hospital will have its own intricacies. But Goa Medical College, when we start heart transplant, we'll be doing it free. We will not charge anything. But to do a heart transplant, you require special kinds of medicines. You need now getting this, coming here, taking that heart, going by flight, all will have some commercial implications. So I do not know what that private hospital is going to charge. Our job was to give this heart to a human who can live.
But
We don't go beyond that.
organs are free transplanted.
All
Only the
organs
charges
are
for the
free.
operation it is.
Yeah. What would be charged was for the logistics of the operations. Nobody will charge for free. That is not at all included in this donation program.
So only two beneficiaries from GMC received the blood.
Yeah. Two is a big number, boss.
Doctor,
And AB positive, we have four, of which two they were matching. There was one from Healthway, but his HLA lab, his histocompatibility was not matching, so we did not give that kidney to him. There was one AB from a private hospital, but to our good luck, both ABs of our wait list they have received.
Under the disease donor program, how many such transplants organ donation? Under
We are, this is I think our fourth donor. It is said that we are little slow in this, but whatever we have done has saved lives.
third or fourth?
This is I think Third. This is third.
Doctor, could you give us an idea of how many people are there on your wait list total? You mentioned that there were
We only do kidney transplant as of now. Our program for liver will start next year because we already started a gastroenterology department under the able guidance of Dr. Amit Maidev. He's going to visit from global hospital to this hospital. He has already been appointed with other gastroenterologists. So we'll start liver program maybe by next year. But as of now, we have only kidney program, and in our kidney wait list, I think we have 42 people waiting. We try our level best to get the donors. The living donors are to be blood related, and sometimes people don't want to donate within the family also because donating kidney there is a morbidity for the donor for quite some time. They also feel that why I should suffer, and there are issues also. So best is to have this cadaveric program. If we understand the whole concept of cadaveric program, then it is easy go. Here the biggest issue is that the concept of brain dead is not understood by the common man. And we have a brain dead certification team which is headed by a neurologist and the physician, and you have to document everything that you do. In this case, we have documented what is known as apnea test. We have done 2 apnea tests. Both apnea tests have come positive. They are documented. So there is nothing that is left without documentation, and hence we declare this brain dead. And once you declare brain dead, you need to maintain these organs circulation. Otherwise, these organs become useless. So these were maintained in the ICU, and then we declared it on the Roto Soto site. And when we declared, we got the waiting list people names, and then we got the team for retrieval. So the heart was retrieved in the morning at 3:30, and it was taken by special green corridor. I must thank police people here because the police provided us great cooperation, and the heart was taken from GMC up to Dublin Airport by a flight because once you take an heart specimen, it has to be implanted soon. And the patient was kept ready by second team in HM Hospital, and moment they reached Bombay, they implanted the heart. And the heart implantation surgery started at 9 o'clock in that hospital. They left my hospital at 5:30 in the morning. 5:30, 6 o'clock they left from GMC, and see how quickly things are done. So green corridor is that nobody stops you, even the security doesn't stop you. This is one great concept that has come from Department of Police.